So, step 1 in the physical activity pathway is assessment. Step 2 is brief advice, and step 3 is brief intervention. A brief intervention aims to motivate and support a patient to become more physically active. It takes a bit longer than brief advice, allowing you to explore in more detail your patient's own particular needs, preferences and circumstances. As with brief advice, it can be helpful to have a simple structure in your head. This could follow the same lines of highlighting the benefits, exploring barriers and identifying solutions. It's important to remain supportive and positive throughout the conversation. It might be the first time the patient has discussed their physical activity with a healthcare professional. This way, they will relax and feel more confident about embracing change. Remember Susan, who we saw being assessed by her endocrine consultant? She is now with Sally, the clinic dietitian for brief intervention.
So Susan, I know you've already met with Dr. Green today. Did she mention why she wanted you to come and have a chat with me?
Well, I've been told recently that I have diabetes, and she said it might have something to do with not being active, but I didn't think that had anything to do with it. I mean, of course, I'm quite happy to come and chat with you if that helps, but it's all a bit confusing just now. I mean, I've got these new tablets to take and everything.
I can hear you're a bit overwhelmed, which is totally understandable. And I'm glad that we're going to have the opportunity today to talk about some of the recommendations for physical activity around diabetes.
I always thought it had more to do with your diet.
Well, diet certainly is one of the factors that's linked with type 2 diabetes, as well as genetics. But the one thing we do know is that low physical activity levels can double your risk of being diagnosed with type 2 diabetes. I don't know, Susan, do you have any idea of the current physical activity recommendations?
I think the doctor said 2 hours, or was it 2.5? I just know that I'm quite a long way off that.
And how does that make you feel?
Well, I knew I could probably be doing a bit more, but to be honest, I never really gave it much thought until today. I certainly had no idea it would have anything to do with me getting diabetes. I'm also feeling a bit guilty because, well, my family are worried about me having to come up to the hospital. So I just hope I haven't left it too late.
Absolutely not. A lot of new patients aren't aware of the link between physical activity and diabetes, Susan, so you're not alone with that one. But hopefully if we can highlight the importance of physical activity for managing your diabetes, it'll enable you to take charge of managing your own condition a bit more.
I want to do whatever I can. All I'm doing at the moment is taking these blooming tablets, so anything else I can do that would help would be great.
From what you've been saying, it sounds like you're finding it quite difficult taking the new tablets. But one of the things we do know is if we can encourage you to become a bit more physically active, it may be that we are able to reduce your medications or even stop them.
Oh, that would be great. I really don't like taking these. It makes me feel like an old woman.
So that's one reason you've come up with already as to why doing more is a good option. Are there any other benefits you can think of for becoming more physically active?
Well, I know it helps the heart, but that's about all.
Yeah, right, Susan, that it's really important for patients with diabetes to keep their heart healthy. It's also important to reduce some of your risk factors, such as high blood pressure and high cholesterol. And the great thing is that we know that becoming more physically active can tackle all of these things at once.
Oh, that's good to know, because I've always been worried about that because my mum had angina. Oh, if I'd known this before, I might never have given up my tennis. I used to love playing that, but it's 20 years ago since I've done it.
It sounds like it was something you really used to enjoy doing, though. Can you remember what it felt like when you were more active?
Oh, it was great fun. I used to play doubles with my husband. Well, he still plays occasionally with his friends, but it's been years, as I say, since I've played.
Do you remember any other good things about when you used to play tennis?
Oh, I used to be a bit trimmer. I remember that. Maybe if I took it up again, maybe I might lose a few pounds.
Well, it sounds like we've identified some really great reasons for becoming more physically active. We know it's maybe going to protect your heart. It might mean that we're able to reduce some of your medications, and the added bonus is that it might make you a wee bit trimmer. Is there anything at all, Susan, that you think might make it difficult for you to start becoming more physically active?
Well, it's such a long time since I've done anything that I don't know if I feel very confident in trying something new. I mean, I've never been in a gym in my life.
Well, I can reassure you that becoming more physically active definitely doesn't mean that you have to go to the gym. It's basically about just trying to do a little bit more and trying to spend less time sitting down. You've already shown some really good motivation for becoming more active. Can you think of any other ways that you can do this? You mentioned earlier that your family were worried about you having diabetes, and I wondered if there's anything you could maybe do with them.
Well, my daughter usually goes to the park on a Saturday or a Sunday with my wee grandson. She takes the dog too and goes for a bit of a walk. I went with her once or twice and had a really good afternoon, but I don't suppose that would count, would it?
Of course it would. Doing something you enjoy is a fantastic way of starting to become more physically active. And if it's something you enjoy, you're much more likely to keep it up. And also spending some more time with your grandchild can't be a bad thing, can it?
Oh no, he's just turned 3, so he's a real tearaway. Keeping up with him alone would keep me fit.
Fantastic. So it sounds like we've identified a few good ways of you starting to become more physically active. Is there anything else you can think of?
Nothing really springs to mind.
I remember you told me you used to really enjoy playing tennis. Is that something you feel you could maybe get back to?
Well, that was years ago. As I said, I've not picked up a racket in about 20 years, but I did love it though.
Maybe after you're feeling a wee bit more confident, it's something we could consider setting as a longer term goal?
Yeah, I think it would be nice to get back to playing tennis with my husband. And if I told him it would be good for my diabetes, I think he'd like that. He feels a bit helpless, I think. But I don't know what else I could do though.
Don't worry at all, because I think you've identified some really realistic ways of starting to become more physically active. Remember, the recommendations for physical activity are 30 minutes, 5 days a week. And I know you probably feel that you're quite far off achieving that at the moment, but it's really important to just make a start, and something is always better than nothing.
Yeah, that's good to know, because I'm not sure how much I'll manage at first, but from what you've told me, I really want to try.
Changing habits does take time, so please don't be disheartened if you had the odd setback. Maybe the most important thing to do is just remember some of the points that we've covered today, and we can cover further issues when I see you again in 3 months' time. But there are some other ways of getting support in the meantime. I've got an information booklet here which reiterates the guidelines for physical activity. And I don't know if you have any internet access at home?
Oh yeah, my kids gave me a new smartphone for Christmas, so I'm getting all techie. I love it.
Fantastic. Well, there's some information which gives you a web address in here for Active Scotland. And if you key in your postcode, it'll give you some information on activities that are taking place in the local area. It might even have something on tennis or walking for you.
All right, that sounds great.
I hope you find it helpful, along with some of the other possibilities we've discussed today. I don't know whether you might find it helpful if we just summarise all the points we've talked about.
Yeah, that would be good.
So from what you've been telling me, it sounds like you've got some really good reasons to start becoming more physically active. You particularly mentioned with regards to helping control your diabetes, as well as improving your heart health. It sounds like there's some really achievable goals which you'll be able to make in the short term. For example, starting to do some more walking in the park with your grandchild, taking things nice and slowly to begin with. And your longer term goal might be to try and get back to playing tennis with your husband. He might like that as well, as it means he'll be involved in your diabetes management.
I think so. Or maybe by next summer I can try and get some games with him. After all I've heard today, I really want to do what I can to help my diabetes. It's great to know that I can take some control in things. I'll just try and build up slowly.
Fantastic, that sounds like a great idea, and it's been really lovely getting to know you today. I'm looking forward to us catching up again in about 3 months' time, and maybe you can give me an update on how things are going then.
That's a really good example of a brief intervention in practice, as you can see the impact it can have for an individual. In just a few minutes, Susan's apprehension surrounding her recent diagnosis of diabetes has been eased, and she now has added motivation and support to take some control of her condition. You may have noticed how throughout this intervention, the dietitian applied the motivational interviewing principles of open-ended questioning, affirmations, reflective listening and summarising. These techniques can enhance a brief intervention, making it even more effective. If you haven't had this type of training yet, you can still explore the patient's individual circumstances in your own way. Encouraging your patient to identify how they will benefit from physical activity is an essential way to get them on board and understand why this is so important for their health. Helping them to come up with their own solutions to barriers they have identified is key. This approach, along with setting realistic goals, will build the confidence of your patients. A short conversation can really make a lasting difference to a patient's health and happiness.